Dr. Goldfarb with Water and Sports Physical Therapy, located in Fitness Quest 10 in Scripps Ranch, Mission Beach, downtown, and Coronado. Today we're here to talk about a pathology that a lot of people have problems with. That would be foot and ankle problems, plantar fasciitis, Achilles tendonitis, and other joint problems in the foot. This is Jeff, one of the trainers here at Fitness Quest 10, and we were looking at Jeff's feet and seeing where the issues are coming from, and it's pretty evident if we look down at his feet. So if we look down here at Jeff's foot, notice right away what he started as. Let your feet relax, Jeff, so they were. They let your feet sort of hang out. He likes being rotated out on the left. That's the first thing we notice. Second, we notice on both sides he does have a pronated foot. That's when the arch comes down toward the floor. What this can cause in time is problems with elongation, over-elongation of soft tissue, connective tissue. The tissue could be the plantar fascia, the Achilles tendon, or other tendons that run underneath the ankle and foot and pull pressure on there throughout the day with even walking or just normal activities. So if we look down at Jeff's foot, we notice he has what's called a Hallux Valgus, early stage of a little bit of a deformity here. The right side, not as bad, so this tells us there could be a problem with pronation on the left more than the right. Eventually, you wear this joint out over time. When his foot is pronated down like you see here, you put more pressure on the talus, the bone here at the ankle, and that changes the mechanics at the knee. So, I'm going to show you what his normal position should be. If we were to take his talus and put it in what we call Subtalar Neutral, we're going to pull up this way. Alright, let just your ankle move, Jeff. Let your ankle come up. A little more, good. Right there. Now this is closer where his foot should be. He's not used to being this high. So a little more. There you go. Now for him, notice his angle changes. He doesn't have that Hallux Valgus like he had when you pull him up. To better alignment of his foot and toe. So if we let him relax down, you see how that foot changes position? Imagine all day long walking or running, having that extra stress on your toe, ankle, knee, up to your hip, or even your back. So the first thing you do is diagnose where the problem is coming from. Plantar fasciitis, Achilles tendonitis, other tendinopathies can come from foot mechanics. So if we figure out the foot mechanical issue, we can treat it appropriately. We'll go over some stretches and some strengthening, but the key is if we figure out if it's a foot deformity, a foot problem, we can give an orthotic, heat mold an orthotic into his running shoe or work shoe, and then it can hold his arch up in the right position all day long so the tendons don't do all the work all day. So let's look at his foot again here. What we want to do is place his foot in subtalar neutral, look at him here, and notice his toe stays up in the air just a little bit. So what he would need is a 4-foot post just to hold him up there like that along with the orthotic inside here. That will give him the correct positioning. If he's like this all day long, what happens is you stop stressing the tissue underneath, partially the plantar fascia. You take stress off the joint and stress off the Achilles tendon and the muscle in the back of the calf, as well as tendons that run underneath the bones on the side of your foot. So, let's go over some stretches you can do. If you didn't get an orthotic, you should get evaluated by a doctor or orthopedic physical therapist to see if you do need orthotics and are appropriate for them. But let's just say you didn't do that and you want to know some stretches to elongate the tissue. Let's show you the normal gastroc and soleus stretch. So Jeff, let's have you turn around, please. I want you to face the wall. And Jeff will show us the normal calf stretch. So what you do here, you've seen the normal runner stretch. Notice how Jeff was originally, his foot was out like this. That's because that's how he walks and runs. We want to look at his alignment and make sure we pull him into a position we want him to stretch where he normally doesn't stretch. So always make sure your heel is lined up straight forward, pointing forward in front of you. Then you bend your front knee and you'll feel a nice stretch, usually through the muscle belly. You should not, I repeat, should not feel any pain in here in the joint. If you do, you should consult a physician or an orthopedic physical therapist. The next stretch you should do is you want to come back, bring your hips back a little bit. Now bend your knee. Good. Now when you bend your knee, the idea is your heel should still stay on the ground. You want to feel a deeper stretch, the soleus, which is the deeper muscle inside the calf, and some on your Achilles. Again, if you feel that pain in the front, you're probably getting compression of your talocrural joint. That's your talus, the bone right up here, on your tibia and fibula. So if you feel pain here, you're probably going to need an orthotic and an evaluation. If you don't, you just feel it here, you're free and clear, usually just stretch, so you hold your stretches for at least 30 seconds for collagen deformity. The next thing you can look at, if you have pain in your plantar fascia, what the idea is that you're constantly overstressing and stretching the plantar fascia. So what we can do is we can stretch it controlled, so when you do end up putting pressure on it, there's less resistance. So how we'll do that is we'll bring your foot up against the wall, you find a corner, and the goal is to get the ball of your feet down and pushed into the wall. So you see, you push that way down and in, and what you should feel is inside, underneath your foot, you should feel a stretch. To add on, you bring your knee forward, and right there, you should get a little overstretch of your Achilles. Jeff, do you feel it through here, underneath your foot, and through the Achilles?
Yes.
That's where you want to feel it. So, those are your stretches. The most important for plantar fascia is probably this stretch right here. You can combine gastroc, soleus, Achilles, and plantar fascia into one stretch. Again, 30-second holds at least. Don't do 5-second holds and bounce on and off. You can actually tear collagen that way. And you want a slow, elongated stretch. The next exercise would be to look at a strengthening exercise. What you want to do, and you can face this way, Jeff, what we want you to do is you want to look at your positioning of your foot. If you don't know what subtalar neutral feels like, I'm going to show you. So I'm going to pull your foot up this way, so just rotate your ankle up, let your arch come up. Okay, that feels weird, but that's okay. That's because you haven't been there. Maybe ever. So what I do is I want you to try to hold this position, subtalar neutral, and try to balance there. So balance this that foot and try to hold it. What you're doing here is you're strengthening the muscles to support your arch. Jeff asked me earlier, why do I have a low arch on this side? And why is it lower on this side than the other? One, it could be genetics. Two, it could have been inappropriate exercise without an orthotic or good arch to support your foot. Underneath your arch, you have a ligament called a spring ligament. It's a ligament that holds your arch up, or helps hold your arch up, along with a tendon that comes underneath called the posterior tibialis tendon. If you do a lot of exercise where you're pounding on that foot, you can actually traumatize that ligament and tear it so the ligament no longer helps hold your arch up. You can also do damage to the posterior tibialis tendon, which can in addition, give you problems with your ability to hold your arch up. So what Jeff's doing is using all his muscles to try to hold that position, and it is difficult. The next goal is to close your eyes. Try to do the same exercise with your eyes closed, and you'll notice, as Jeff closes his eyes, it's a lot more difficult. However, you're still going to try to do that, and you try to hold that as long as you can without feeling like you're going to roll your ankle. What Jeff wants to do is he really, for him, is going to get orthotics. To try to make the muscles do what they're not meant to, which is support an arch that's fallen, is really not appropriate. You can try, but studies show you're not going to be able to do the job. You need a passive lift at all times so your muscles aren't firing all day long. So for him, an orthotic will be best. We'll hold his arch up all day long, and he'll have less stress on the plantar fascia, the Achilles tendon, the talocrural joint. That will lead to less knee problems, hip problems, and back problems. So if you are in need of an orthotic evaluation, feel free to call us or any other physical therapist in your area and ask that they do custom-fitted orthotics. My suggestion would be an orthotic that fits into your running shoe and is molded in your shoe is probably the best way to go. So you don't have a sneaker that has an arch support and then add an outside orthotic that doesn't accommodate for the sneaker. So try to find one that has both, an orthotic that's molded into your shoe. Thanks for being here at Water and Sports Physical Therapy.